السلام عليكم ورحمة الله وبركاته. Welcome to hip development. Now, this is a new topic, the hip development. It's very important to understand the hip development. I'll take in, in both views, okay? Let's start by what we will study in the hip development, the normal, what's the normal hip development, what's the chondrification, ossification, primary ossification centers and secondary, the acetabular cartilage complex, the abdominal bone, blood supply, and the femoral hip development. All of these will follow the development of the hip joint. Let's start by hip joint development. Normal hip development requires the seated head of the femur inside the acetabulum. As much as the head of the femur is seated inside the acetabulum, the hip joint will be formed. Head of the femur work as a template. This is a sphere, and this is responsible for forming the depth of the acetabulum and its width. So it's making as a template. At the same time, the acetabulum works as a template for the femoral head. The depth of the acetabulum and the width of the acetabulum will form and mold the femoral head. Also, the femoral head and the acetabulum should be in movement, not just in fixed. Not if they are seated, but there is no movement, so there is no formation. The movement represents the forces. We have forces exerted when the head is moving on the acetabulum, moving on the femoral head. So we'll see the movable femoral head working as a template on the acetabulum, and the acetabulum, movable acetabulum, well seated. Also, acetabulum on femoral head, movable acetabulum will allow the formation of the femoral head and acetabulum. And for good hip development, we need an intricate or delicate growth of or balance of the growth of the femoral head and the acetabulum. The femoral head and the acetabulum, both of them, if they are growing in appropriate way, so we have an healthy and good hip joint. This development need blood supply. We know that the bone formed by replacement from mesenchymal cells to chondral cells to bone cells. So we have to bone tissue, chondral tissue. So this is replacement of tissue. This replacement of tissue and development needs the blood supply, especially for the we will say here the growth plates, and that needs a blood supply for this proliferation and cell division. If we have a lack of blood supply, that will affect the development. So adaptation of the blood supply to the bone growth changes at this process is very important. The hip development started from the embryo at the 4th weeks of gestation, where the blastocyst leaves the fallopian tubes and implanted in the uterus, and the embryo start. At that time of the embryo start, the hip joint start to be formed, and it will be developed from stage to stage to stage, from the embryo to the fetal stage to the newborn, the childhood to the adulthood, and will be fully formed at about 25 years old. So from the first month of gestation till 25 years old, this is the lifespan of development, or this is the stage of development of hip joint, from the early formed to full formed at 25 years old. This needs first, genetics. The genetics will affect the formation of the hip joint. Also, the environmental circumstances, especially the forces around the hip joint, because I said bones is reacted to the forces around the bones, and so the formation environmental circumstances is important. Also the biological factors, the shapes and the structure of the contents and the structure of the joint is very important. Why we have to start to study the normal hip development? Studying the normal hip development allow us to reinforce or empower the development of the hip joint at each stage. Because if we look to the hip joint development, we all will know clearly that movement has a direct effect because the movement is essential for him. So how we can communicate with the osteoblast and the and the chondroblast, the chondrocyte, sorry, and the osteocyte, these cells are responsible for the bone growth, whatever in its structure or its contents. So it's very important to study to support and empower and reinforce the development. Also to diagnose any genetic disorder happen, any trauma, dislocation, or fracture happen, or any diseases happen to the hip joint, we have to understand at what stage and how to diagnose the problem and how to prevent it, and later on we can treat it also if the problem is already happened. Hip development starting, I said that from the embryo at the 4 weeks of gestation, when the embryonic stage started, and this is the lower limb buds started here at the early stage, and then at the fetal stage, later after embryonic stage, the embryonic stage is the stage of formation of our body. Almost of all of our body organ, or most of them, are formed in the embryonic stage. One of them is the hip joint. And then in the fetal stage was started from about 11 to 14 weeks of gestation. This is a period of growth and development of the hip joint, but it is all over formed at the embryonic stage. And then continue its development postnatal from the newborn to the adulthood or to the adult, young adult at 25 years. So this is the hip joint start here at 4 weeks of gestation and finish here at 25 years of adult, early adult, young adult with be fully formed. Let's start to take it step by step. First, this is the embryonic stage, which starts from 4 weeks of gestation and ends about 10 weeks of gestation. We have a process, we call it chondrification. Chondrification means formation of chondral bone. This happened, we said that the embryo, when the blastocyte leaves the fallopian tube and implanted in the uterus, now the embryo start, or the embryo, now we have the buried embryonic, and now we have an embryo. The embryo have differentiate to 3 layers, the ectoderm, mesoderm, and the endoderm. The mesoderm is the layer which is responsible for formation of the bone. Now the bone will be started to form it. Okay, the bone started to be formed at this period. We have what we call it, what we have now, the mesoderm differentiated into the mesenchymal cells. The mesenchymal cells will be differentiated into two chondral cells, or chondrocytes. These chondrocytes accumulated in this area. This is the ileum, supposed to be the ileum, and this is supposed to be the pubis, and this is supposed to be the ischium, and then proliferate and then fuse together and make a depression between them. This is the acetabulum. And at the same time, or not at the same time, precede them, the femur also have 3 sides. At these 3 sides, the central part, the proximal part, and distal part, these 3 sides of the femur, the chondrocytes start to be formed and proliferate and growing and then fuse together to make now the femur, and now we make the innominate bone. This is one segment. This is the start of the hip region here. And then this proliferate more and more, and then we have a femur and the innominate bone. This pubis supposed to be a pubis. All of these are chondral bone. Pubis, ischium, ilium, and femur. At that time, that happened at about 6 weeks of gestation at embryonic stage. At about 7 weeks of gestation, a process happened between or at the junction between the femur and the innominate bone. The process, what we call it apoptosis. Apoptosis is a cell death. This cell death happened between these two parts, and now what is formed is fluid-filled cleft. The fluid-filled cleft. So we have innominate bone, fluid-filled cleft, and femur bone. So this is the first hip joint. This is the first hip joint that is done at the 7 weeks of gestation. We have the innominate bone with its depression, which represent the acetabulum, and the fluid-filled cleft, that like the synovial fluid or the capsule, and then the femur. This is the first hip joint that starts at 7 weeks at gestation, and this is the start that cause the DDH, developmental head dysplasia, and other abnormalities could happen from that stage. Now we leave the embryonic stage. I said the embryonic stage is the formation stage. Now we formed the hip joint, and now we are transferring to the fetal stage, which is the stage for development and the growth of the hip joint. We're starting here. This is for the femur. I said all the time the femur precedes the acetabulum. The femur here we call it here the ossification happened now in the fetal stage. What's the ossification? Ossification is formation of bone tissue, like chondrification, formation of chondral tissue. And we see that bone process or bone growth depending on replacement. Chondral tissue replaced by bone tissue. Now we have a chondral tissue in the embryonic stage. Now we want to change it to bone tissue at the fetal stage. We started by primary ossification center here, and also ossification continue in postnatal in secondary ossification centers. What is primary ossification centers? The chondrocytes will be died and replaced by, or be differentiated, replaced by chondroblast. Osteoblast. The osteoblast from the mesenchymal cells also, they proliferate and they are forming the bone tissue. All the bone tissue structure, I'll discuss it with you in a separate lecture later on. So this is chondral tissue, and now the osteoblasts start to form here, and now we have the first ossification center on the shaft of the femur that happened about 8 weeks of gestation. And now it will, from that side, from the ossification center, this is the direction of flow of growth. Now it will form the chondral cells into bone cells, and by that way, and also the chondral cells proliferate in that way. So the chondral cells proliferate or has a division or growth up, and the bone tissue followed and it changed and replaced it for chondral. Chondral starts the growth, and bone tissue replaced the chondral tissue by that way. So, and this is the fusion the shaft is going after birth to at the birth, sorry, to the lesser trochanter, and it will be fused together with all of the femur about 18 years. Also, we have for the innominate bone, we have a secondary ossification center at the fetal stage from 11 weeks of gestation till the end of delivery. Okay, we have in innominate bone, we have 3 centers: one for the ilium, second for the pubis, and third for the ischium. This is the 3 ossification centers. I said that these 3 bones grow together, the ilium, pubis, and the ischium, and they meet and make a depression here. We call it the acetabulum. And see, this is the meeting. This line we call triradiate cartilage. I'll talk it with you in clear lecture because this is very important and responsible for the development of acetabulum and so the development of the hip joint, healthy hip joint. See here, there is a line here. This after the ilium developed here. This is a cartilage here between the ilium and pubis, and here also a cartilage between the ilium and ischium, and this is vertical line between the pubis and ischium. So this we call it triradiate cartilage, and here we have ossification center. This ossification center proliferate in that way to increase the bone tissue, and the chondral tissue also increased by the cartilage here. Okay. And this start about 16 weeks of gestation at 60. So 16 weeks is important for second for primary ossification center for the hip joint, and they are about diffused about 7 to 9 years. Don't forget 7 to 9 years. The 7 to 9 years is also a stage, very important stage, because fusion of the innominal bone happened at that time, not complete fusion, but the fusion between the hip, these three bones happen at that time. So this is responsible for the formation, or there will be a limited, a well-formed acetabulum at this point. So 7 to 9 years is important time, important date. Okay, now we go to the further to the hip development in the postnatal after delivery, that start from newborn, neonate, to the 25 years early adult stage. Okay, the femur has, we said that all the time, femur precedes, femur come first. Femur have three centers of ossification. We have a greater two head of the femur, greater two counter, and lesser two counter. But here I am talking about especially about the greater two counter and lesser and the head of the femur, because they are the proximal part that connect to the acetabulum to form the head joint. These are the ossification centers, and these ossification centers start in the head of the femur about 4 weeks or 1 month or 2 months after delivery. They start to, in the newborn, the ossification center start here at the head of the femur, and the greater to counter about 2 and 5 years, and also a lesser to counter, but about 12 years. But it is not mean a lot for me. Okay, these parts fuses at 18 years. So we have a period for formation of that the type of the head of the femur. The head of the femur has three growth plates, very essential growth plate. See, this is a growth plate here. This is a growth plate. This is for, see, this is all of the cartilage. So this is what we call it. This is the longitudinal growth plate. This one, see. Now the bone tissue replaces the cartilage. See, this is the blue one is the cartilage. The longitudinal growth plate, this is the greater two counter growth plate, and what we call it, this is isthmus growth plate. So femoral isthmus growth plate, the longitudinal growth plate, and this is greater two counter growth plate. Three growth plate, and this growth plate allowing growth in that direction. Allowing for this growth plate here, the hyaline cartilage grows in that direction, and the bone follow, and this also the growth plate allow growth and go in that direction, and bone follow, or ossification center follow. By that way, the head of the neck of the femur will be elongated and more thick, and also these three plates, growth plates, and its position responsible for the orientation of the head of the neck of the femur. And the orientation of the neck of the femur is responsible for the orientation of the head of the femur, and so the orientation of the hip joint. So these three growth plates is very important. We have two projections here, the greater two counter and head of the femur, and both of them should be balanced for the muscles attachment and the everything about the orientation of the head of the femur and neck of the femur and hip joint. And I talk about this issue later in second lectures or other lecture. But now we have to understand the importance of these growth plates. We have three growth plates. Also, we have lesser to contrary growth plate, but I said it is not important for me because it is not responsible for formation of the proximal part of the femur that is joined with the acetabulum for the acetabulum, for the hip joint. The other one here for postnatal, also I will talk about the ossification, secondary ossification centers. I said secondary ossification center happened postnatal, primary ossification centers happened in the fetal stage. Here we have the nominate bone, we have 6 secondary ossification center. We remember that we have 3 primary ossification center at ischium, at pubis, and ilium before. Now we have 6 ossification centers. These are responsible for the formation of the nominate bone. As the nominate bone proliferate and be bigger, the depth of the acetabulum is supposed to be more depth and more wide. Okay, so what happened here? We have here, this is the 6 growth plates. It's working like an epiphysis. These are a flat bone, but like an epiphysis of these 3 bones. See first the ilium here. We have the iliac crest, so this is the epiphysis, so it grows in that direction up, and this is the lesser to posterior superior posterior inferior spine, so it is grow in that direction. And here, what I call it to you, this is the triradiate cartilage. Behind or beneath the triradiate cartilage, here ossification center, here ossification center, here ossification centers, here behind this or underneath the cartilage, because as the cartilage grow out, it replaced behind them by bone tissue. So the chondral tissue formed, and then the bone tissue formed behind, so the growing start. So the triradiate cartilage, what you see, this is the cartilage between the ilium and the pubis in the ischium here, and is responsible for a development of the acetabulum in that area, and also here between the ilium and pubis, and this is also responsible for the wideness and depth of the width and the depth of the acetabulum, and the vertical line here between the pubis and ischium, and also responsible for development of good acetabulum. Also, this is what is the ramus cartilage here, or blade, and this is the ischium, and this is the pubis plate. These are responsible for these 6 plates responsible for development of the hip joint. In the next lecture, we will talk about the movement development. How the movement development of the hip joint, how to start step by step the development of the hip joint movement, and also I'll talk about the hip joint development in the arterial blood supply, how the blood supply developed in this area, which is responsible for its development. Thank you for listening. I hope to understand what I said.